Welcome to Module 7 of our educational program.
Last week, I went over infant and child feeding problems and solutions. A feeding problem is when a child is not progressing through the typical course of steps to independent feeding of table foods. OT can help in so many ways by helping to identify the feeding problem, setting parent and child-specific goals, and occupational therapy can also help problem solve these difficulties with interventions. A majority of infants with more severe feeding disorders have medical and/or developmental conditions that predispose them to or are associated with difficulties feeding, such as conditions like cleft lip and palate, cerebral palsy, maybe the baby has food allergies, etc. Many types of eating problems. There are many types of eating problems, such as food selectivity, food refusal, and more. And occupational therapy helps identify your child's eating problems through evaluating your child's current eating pattern and figuring out what is occurring to prevent your child from eating a balanced diet. Occupational therapy may also focus on behavioral interventions, oral motor treatments, physical and sensory treatments, adjustments to diet, and the methods of intake or a combination of these approaches.
For my review of last week's module, I went over mental health impacts. So we learned how mental health in the parents can impact the relationships within the household, such as with their spouse or their baby, bonding and attachment with their baby, and how it can all impact the ability for a parent to be an effective caregiver. We learned about how mental health in the parent can affect sensory, behavior, cognitive, and sleep in the child. And then we also learned about how creating a positive and nurturing environment is important. In my module today, I would like to discuss how important parental involvement is in the early intervention setting and how maternal mental health may affect this. So let's begin this module by discussing the purpose of early intervention services. Some of you may have had multiple experiences with EI coming into your home, and for others this may be the first time. Regardless, early intervention is an amazing service that families have access to. In an early intervention program, you will receive evaluations and ongoing assessments for your child to track their progress and determine what needs to be met in order for them to be on track and hit all of those important milestones. We have service coordination and of course the interventions that are done by the therapists and other disciplines within the home. We have support services for families, IFSP collaboration to ensure that all of the goals are really tailored to the family's goals. And of course, a main goal of EI is to improve and/or increase parenting confidence or efficacy when working with your child to help create the best supportive environment for them. So why are caregivers important? So EI is routine-based, which means they are coming into the home to provide interventions and resources that you can use within your daily routine. And normally the parents are the ones making the daily routine. So parents are especially important in discussing that with their therapist, what their daily routine looks like or what they hope for it to look like in the future. It's parent-mediated, which means the parents create all of the goals that they want their child to meet. Parents are also coached through activities from the therapist. So rather than the therapist coming into the home and doing all of the work, they want the parents to be involved and they want to show the parents how to do it so that they can increase their skills and their confidence with what they need to do when the therapist isn't around. And then activities and strategies are optimally continued outside of the therapy sessions. So parents are extremely important because they are the ones that need to recreate these resources or skills outside of the normal therapy time. This is what we call carryover in therapy, and it is when the activities are continued even outside of the sessions. So this will guarantee the best success for your child. So next we will discuss coaching. This is a quick concept that therapists may use when they come into your home. This further emphasizes the importance of parental involvement. This approach is called the coaching model, and this is when therapists coach parents through activities and tasks that assist the child in reaching those developmental milestones. It is important to remember that even though early intervention is focusing on teaching your child skills, the parents are also being taught and led through these sessions. So here's a great reason why present parents are needed in an EI program. The parents themselves identify the goals and their priorities for their child, and the therapist and the parents will work together to create activities and a plan of action in order to see the most developmental progress from your child. So how do therapists encourage parent involvement in and out of sessions? Or why is it important for a parent to be involved? So parents have the most important influence on a child's early development. Children at this age are watching their parents and watching them go through that daily routine, and that's how they learn a lot of their skills. A child's learning occurs in their natural environment through daily routines. And parents provide the opportunity to have educational interactions throughout the day. So obviously, therapists are only in the home for a short period of time, but the parents are the ones spending the most time with the child. So, for example, instead of just walking up the stairs, parents have the opportunity to walk and count the stairs as they go up. So even just those little educational moments that they have throughout the day, the parents are the ones that are executing those mainly throughout the child's childhood. So you may be wondering, what does all of this have to do with having a mental health diagnosis? The truth is, early intervention is much more successful when parents are attentive and supportive. Mental health diagnoses, as we have learned, may affect concentration, sleep, physical health, and ability to function at your best. In early intervention, skills are taught with a parent focus. So we want parents to be able to utilize skills and ideas they learn outside of the therapy sessions. So overall, a mother's way of interacting with their child has an influence on if a child has developmental improvement or not. And how parents interact and respond to their children affect development, communication, and social well-being within the child. And poor mental health can overall just affect their daily interactions that they have with the child. Continuing on with how mental health can affect involvement, so studies show that poor mental health in parents can be associated with being less responsive to their baby's cues, such as discomfort or crying. They can be less likely to follow routines or have the motivation to follow a routine, and they can be less likely to engage in early learning activities such as reading books in the first year. Now, especially in those last two bullet points, you can see how that could affect the early intervention success. Having difficulty with routine can make it hard to fulfill your role as a caregiver, but it could also make it difficult to have that extra time to spend for activities. And as we were discussing in this module, parent involvement in using strategies outside of therapy is super important for the success of EI during this time. We have to think about also how mental health in general takes a toll on a person physically. Think about how it feels when you get something such as the flu. It is hard to complete our daily tasks, right? So we need to think about this in terms of mental health as well. If you're not feeling your best, it is hard to function at your best. This is a video I think that does a good job at summarizing the impact that parents have on their child's development through being responsive and sensitive to their child's needs. So I would like to discuss some fun activities that you can do with your child while simultaneously supporting their development. So let's discuss some activity ideas on days when you are in a good mental health headspace. Building a fort can be a fun activity and it encourages the child to use their imagination. Making crafts is one of my favorites just because there are so many benefits and it can be made easier or more difficult for the child's skills. This can work on shapes, counting, scissor use, and also sensory play with the glue. Sensory play is also a great one, and it can really be done in so many ways at any age. For babies, maybe allow them to touch and feel all different textures on their hands and feet. Allow them to play with safe toys and objects and let them put them into their mouth. For older activities, anything involving different textures is great. Let them help you cook in the kitchen, and in the summer, maybe dig dirt and do some water play. And then in the wintertime, maybe do snow play. You could bring the snow inside and watch it melt, or maybe dye the snow some different colors to make it more engaging. Making an obstacle course is something the child and the parent can both participate in, and it can work on motor skills and their body awareness. Drawing and coloring is of course a favorite, and just like crafts, it can work on a lot of different skills. And the last one I have is stacking blocks. Any kind of stacking in building is beneficial for children and can be modified in a lot of different ways. So we have learned some basic ideas on how to support your child's development, but what about those days where you may not be feeling the best physically and or mentally? Being a parent is hard, and just because it may be hard to squeeze in all the extra developmental activities does not mean that you do not support your child's development. It is important not to let the guilt take over. So let's talk about some things that we can do that do not involve a lot of extra work. For our babies, tummy time is a great activity. It encourages to use all of their muscles and allows them to explore their environment. Reading books and singing songs is great for brain development as well. The best way to ensure you're doing activities with your child through the day is just to embed them into your daily routine. Sing songs in the car, read books before bedtime, count the stairs as you walk up and down, color code and match socks and clothing during laundry time, and allow them to help you follow a dinner recipe and so on. So next we'll talk about the importance of carryover. So why is carryover important? Carryover is the ability to carry over strategies and interventions outside of therapy. A child is only seen for 60 minutes per week by the treating therapist. That leaves a lot of extra time that passes between appointments, but also a lot of time throughout the week that the strategies could be implemented. Working with the child on the strategies and activities that you and a therapist have made together really guarantees the best successes and allows your child to fully benefit from services. Talk to your therapist if you feel that your mental health is making carryover difficult. You and your therapist can collaborate on ideas and activities that may be more sustainable for your present lifestyle and routine. Your therapist may also be able to connect you to some resources and professionals that can help. So some final thoughts for today's module. Parental involvement is super important during and after therapy sessions in order for your child to fully benefit from the services. Poor mental health can actually have an effect on your child's developmental progress and your involvement in EI. Developmental activities do not have to be stressful, and they can easily be embedded into some daily routines. And talk to your child's therapist if you are needing assistance or resources. So a couple resources I have for today's module. On Facebook, I did find a page called Early Intervention Mama, and she has a lot of resources on different activities and information for parents on there. And then, of course, there's also Parent to Parent of Pennsylvania. I have the number and the email listed there, and it links families together that have children or adults with disabilities or special needs. So the parents have contact on a one-to-one basis with a peer supporter for purposes of support and extra information, and it is free and confidential. Here is a knowledge check for today's module. A mother's mental health status can have no effect on a child's developmental progress in an early intervention program. Is that true or false? So the answer to this knowledge check is false. A mother's mental health status can have an effect on the child's developmental progress in an early intervention program.
My topic this week is the connection between nutrition and childhood disorders. By the end of this presentation, you will understand the importance of nutrition, define nutritional problems, list the components nutrition can play a role in, explain Gerd, and explain celiac disease. Nutrition is important. Not only does it help your child's brain and body develop to its optimal potential, but it enables your child to live a healthy life, maximizing energy and minimizing illness. All nutritional problems fall into one of two categories. Either something is bothering the body or something is missing. When beginning to solve nutritional problems, ask yourself this: is my child reacting to something they are eating, or are they not getting enough of something? When you first ask this question, you might not be able to distinguish between the two, and often both are present. Trust your gut when it comes to something seeming off with your child, and if you're unsure of the root of the problem, consult an experienced professional. All of these problems on the slide have a nutritional component. If your child is suffering from any of them, Examine their diet and consult with a healthcare practitioner. As I can't go into how nutrition affects everything in this list, I decided to choose several problems that play a role as well as solutions to those problems to discuss in this presentation. The first nutritional problem I'm going to discuss is gastroesophageal reflux disease, aka Gerd. This is when food and acid from the stomach go back up into the esophagus, causing your child to spit up or throw up. Gerd causes problems such as poor growth, vomiting, damage to the esophagus, pain and irritation in the nose and mouth, along with other symptoms such as chronic coughing or feeding problems. Signs of GERD in babies and young children include choking or wheezing if the contents of the reflux get into the windpipe and lungs, wet burps or wet hiccups, spitting up that continues beyond a child's first birthday when it stops for most babies, irritability and inconsolable crying after eating, refusing to eat or eating only small amounts, failure to gain weight. Some of these symptoms may get worse if a baby lays down or is placed in a car seat after a meal. For children under 2, the muscle tone around the stomach muscles has not developed enough to keep the tummy shape stable and pressure off the lower esophageal sphincter. This is the door between the esophagus and the stomach, also known as the LES. The reason most spitting up stops on its own by age 1 is that children are usually walking by then and have not developed their abdominal muscles enough to hold the shape of their belly, so it doesn't put excessive pressure on the opening. The second reason for reflux symptoms is that food can irritate the gut lining, causing the stomach to want to get rid of it. This can be an allergic or non-allergic reaction. Responding to your child's reflux depends on a number of factors, primarily his or her age, as well as the degree of their reactiveness to casein or soy. Here are some solutions to discuss with your pediatrician. If your child is 12 months or younger, remove potential irritants, usually from formula. This is an important consideration. Talk to your pediatrician about commercial formulas made from proteins, other casein, such as whey or soy. There are physical positions that help take pressure off the baby's LES as well. Doctors recommend keeping the baby in a vertical position after eating because sitting upright puts less pressure on the LES so it can keep the stomach contents in the stomach. A baby's sleeping position can also be adjusted. Some doctors recommend that babies with reflux sleep on their stomachs. Keep in close communication with your healthcare provider so adjustments can be made if formula and positioning is not working. Here is a quick video to help you understand more about reflux in kids. Here are some solutions to discuss with your pediatrician regarding GERD if your child is over age 1. Consider removing dairy foods from the diet. Discontinue milk, ice cream, cheese, yogurt, and pudding. Do not worry about butter or the small amounts of dairy products that may be cooked into something like a piece of bread. If the child turns out to be highly reactive, you can go back later and take out foods with minor dairy components. If your child likes to drink milk, consider goat's milk. Plain rice and almond milk are not suitable milk substitutes on their own and should not be given to the children under age 4. They have little protein, few nutrients, and not enough fat to be considered nutritious. If you're afraid of your child trying something new, try mixing goat's milk with cow's milk in equal proportions for the first week, then completely remove cow's milk the second week. Remember to consult your pediatrician when making changes in your child's diet. Also, make a plan with your doctor for slowly reducing reflux medicine as symptoms improve. Celiac disease is another nutritional problem children can have. Celiac disease is an autoimmune disorder. It happens when someone has a food intolerance to gluten. Gluten is the general name of proteins found in wheat, rye, barley, and other grains that are in many everyday foods. Most of us eat food with gluten with no trouble, but for some people, eating gluten can cause a reaction in their bodies. Someone who has this problem has celiac disease. In celiac disease, the body can't absorb important nutrients. If that happens, a person can become malnourished. Doctors don't know for sure why the immune system reacts to gluten, but if your child has celiac disease, there are ways to manage symptoms and prevent damage to the intestines. No one is sure why celiac disease happens, but it appears to run in families, so a child with a family history of the condition may be more likely to get it. It also can happen along with other disorders, such as Down syndrome, Williams syndrome, type 1 diabetes, and autoimmune thyroid disorders. Many people who have celiac disease do not know it. If all these people were diagnosed, celiac disease would be more common than type 1 diabetes. Many kids are diagnosed when they're between 6 months and 2 years old, which is when most kids get their first taste of gluten in foods. For some children, the problem starts slowly, and the symptoms may be terrible one week and not as bad the next. Because of this, some people aren't diagnosed with celiac disease until they're older. The problem is chronic, which means that although symptoms may come and go, people who have celiac disease will always have it. Signs and symptoms of celiac disease include diarrhea, constipation, pale, foul-smelling stool, stomach aches and bloating, decreased appetite, weight loss, poor growth, tiredness, and headaches. Diagnosing celiac disease usually starts with a blood test to look for antibodies to gluten and other proteins in the intestine's lining. Antibodies are proteins the immune system makes that recognize and get rid of germs and other things it sees as threats. They usually stay in our bodies in case we have to fight that germ or problem again. If the blood test finds high levels of antibodies to gluten, the doctor probably will do a biopsy of the small intestine to send for testing. If a child is diagnosed with celiac disease, their siblings, parents, and grandparents should also get tested. They could have the disease but not show symptoms. Celiac disease that isn't found in adults for a long time can lead to other health problems. How is celiac disease treated? There is no cure for celiac disease. Researchers are working on new treatments and many show promise, but for now the condition is managed with a gluten-free diet. This lets the intestinal lining heal and helps ease symptoms. If your child has celiac disease, the doctor will guide you on which foods your child can eat and which to avoid. These dietary changes will have a big impact on your family's everyday life and your child's diet, so the doctor may suggest that you meet with a dietitian for advice. Your child's diet should have no wheat, barley, rye, and related grains. No law requires food manufacturers to list gluten on food labels, so making sure your child um, avoids it can be hard. In the United States, all foods must be clearly labeled if they contain any of the top 8 food allergens, including wheat. But wheat-free doesn't mean gluten-free. Some wheat-free products may have gluten-containing grains like barley and rye in them. Carefully read food labels on all items before you buy them or let your child have them, and help your child learn to do it too. The Celiac Disease Foundation's website lists many foods and drinks to watch out for. You also want to find safe food options. Some tips to remember when choosing foods include: start with the foods your child can eat. Safe foods and ingredients include foods made with flours of corn, rice, buckwheat, arrowroot, garbanzo beans, which are chickpeas, quinoa, tapioca, teff, and potato. Also okay are all plain meats, fish, chicken, legumes, nuts, seeds, oils, milk, cheese, eggs, fruits, and vegetables. Watch for cross-contamination as well. Sometimes gluten-free foods can come into contact with foods that contain gluten. For example, crumbs from regular wheat bread can find their way into jams, spreads, or condiments if people aren't careful to use a fresh knife or utensil each time. Keeping condiments in squeezable bottles and using separate peanut butter, jams, and spreads for people with celiac disease is a great idea. You might also keep a separate toaster for gluten-free bread. You want to make sure All appliances, utensils, and work surfaces are clean before you make gluten-free products, especially after handling foods that contain gluten. Wash your hands well and often when you prepare food. In restaurants, tell the server or the kitchen staff about your child's condition so they know that your child's food must be free of gluten and related ingredients. In grocery stores, most carry some gluten-free bread, cereal, baking mixes, cookies, crackers, and other products. Health food stores and natural food markets may have wider selections of these foods. Skip gluten-free products from bulk food bins because of the risk of cross-contamination. Again, a dietitian can help adjust your child's diet. Talk to your pediatrician for recommendations on finding a dietitian if you are having trouble. Occupational therapy can also help develop a mealtime routine revolved around your child's new dietary changes. This is a video I found that recaps what I've presented in the PowerPoint regarding gluten and celiac disease. Here's a knowledge check question for you. True or false? Celiac disease occurs when food and acid from the stomach go back up into the esophagus, causing irritation. The answer is false. Gerd occurs when food and acid from the stomach go back up into the esophagus, causing irritation. A great resource for this presentation is the book titled Cure Your Child with Food. It discusses solutions for Gerd, celiac disease, and many other nutritional problems your child may be experiencing. You can find it on Amazon, Walmart, or eBay starting at $6.